Hello, I'm Dr. Gerald Chodak for prostatevideos.com. In this video, I want to talk about minimally invasive methods for removing the prostate. That includes a laparoscopic approach and a robot-assisted approach. Both of these are newer ways of doing the operation compared to the retropubic and perineal operations. Many people have gotten very excited about these minimally invasive approaches with the hope that they would provide fewer complications or make things easier for men to recover. And that seems to be the main advantages. There seems to be less blood loss associated with this, and patients may be able to go home a little sooner and may be able to resume some activities like playing golf a week or two earlier. In terms of the overall question of how it compares in terms of long-term complications or cancer control, at this time there is no evidence that you either have a lower chance of impotence or incontinence or a higher cure rate with these minimally invasive approaches. So the best we can say is these are all reasonable alternatives for removing the prostate. Now, first, some information about the operation itself. The way the operation is done is to make several small incisions, maybe about an inch long, that allows the doctor to put instruments through the skin and look inside and then do the operation while watching a television screen. So it's like playing Atari for adults. And by doing this method, they can see very well and they can do the operation that removes the entire prostate and the seminal vesicles and a portion of the vas deferens. In some cases, they will also remove some lymph nodes, depending on the circumstances for your individual case. The operation takes, on average, about 2 to 3 hours, although sometimes it's done much longer than that. And it's usually done under a general anesthetic. Patients stay usually for one night in the hospital, and they will go home with a tube in their bladder that comes out through the tip of the penis. That allows healing to occur and drains the urine out until that happens. The tube usually remains anywhere from 3 to 5 days or sometimes longer. The recovery process is similar to the other operations. It does take time to regain urinary control and regain sexual function. Occasionally, men will have those functions return early, but it may take even up to a year or longer before full control or full erections can return. The complication rates that have been looked at long-term seem to be similar, and they depend on several factors: your age, your health, and probably most importantly, the surgeon who does your operation. It appears that with surgery, and this operation in particular, the more experienced doctors seem to have fewer complications. So one of the questions you want to ask the doctor who's taking care of you is, how many do they do per month, per year? How many have they done in total? It looks like you need to have done somewhere of at least 50 and probably more to have enough experience to get reasonably good results. Unfortunately, in the United States, the average number done by most doctors is probably under 15. So asking about the doctor's experience is important. Another important thing to do is to ask about complication rates. There are reports that are published in the medical literature that share different doctors' results. But the real thing for you is, what are your doctor's results? It doesn't matter what some expert is getting, because some expert isn't the person that's necessarily taking care of you. You want to know, in addition to how many they do, what are their specific complication rates? What percent of the men have impotence or incontinence? How many get strictures? What is the transfusion rate? These are very important things that you have a right to know about from your doctor. Now, how does the doctor get that information? Well, they can either do an estimate of their results, or in some cases, they use questionnaires or surveys that have been validated and are used by different doctors around the United States. Perhaps one day, all doctors will be required to use those questionnaires, because without them, it's hard to really know what the complication rates will be for an individual surgeon. If your surgeon does not use those surveys and is simply estimating the results, it doesn't mean you can't have that doctor take care of you, but it may be one more thing to consider about whether or not you want to go see someone who specializes in doing this operation. Around the United States, there are people that maybe do 100 or 200 per year. So that is their main focus, and they are likely to get better results, but that's not a guarantee either. So in the end, we have these minimally invasive approaches. They are reasonable alternatives. The real issue for you to decide is not what method you want for your operation, but first, do you want surgery as your treatment? And secondly, who should do your operation so that you have a chance to get the best results possible? For now, we can't say for sure that one method is better than the other. They're all reasonable options. Each has pros and cons. And if you watch some of the other videos, you'll learn about the advantages and disadvantages of the other approaches, and then be able to decide which treatment is right for you. I hope you find this helpful information. Thank you for watching.